Today's numbers reflect the last 48 hours since we provided the last update on Saturday. I am pleased to report that 6,698 Albertans have recovered from COVID-19, leaving 355 active cases in the province. Currently, 44 people are hospitalized with COVID-19, with 6 of these in ICUs. Since Saturday's update, we have now surpassed the 300,000 mark for tests completed. Out of 11,025 new tests completed over the last 2 days, there were 64 new cases. We also have results for the asymptomatic testing we have been offering since May 12th. We will be providing this in a weekly update going forward. Since May 12th, of those we have tested with no symptoms, no known contact with a confirmed case of COVID, and no known connection with an outbreak, we have processed 14,853 tests, and of these, only 6 have been positive. In the last 48 hours, we have also confirmed 3 additional deaths in the province. This brings the total number of lives lost to 149. I extend my condolences to the family and friends of these individuals, as well as anyone grieving the loss of a loved one from any cause. Over the weekend, we were alerted to a number of cases linked with the Safina Foods processing facility in Edmonton. 6 cases have been confirmed, and all cases and close contacts are now isolating at home. With AHS's support, the facility has moved swiftly to implement all outbreak protocols. Site-wide employee testing is now being arranged, and we will continue to closely monitor the situation. These cases are part of a small jump in COVID numbers in Edmonton, some of which are related to ongoing spread from several social events where transmission happened over the past few weeks. With the slowdown in cases in Alberta, I know it has been tempting to believe that we can relax all precautions. Unfortunately, this is not the case. It is critical that all of us continue to take steps to protect our communities. This weekend, we saw many people participate in demonstrations to speak out against racism. I want to commend all those who wore masks and stayed 2 meters away from others while showing up to rally in support of this cause. The freedom to protest is a critical one, and yet we face a challenge in this time of pandemic to do so without risking super spreader events. I want to encourage all those who attended protests this weekend to go for COVID-19 testing whether or not you have symptoms. Contact tracing would be extremely difficult in large crowds such as this, so please also be mindful of your actions in the coming 2 weeks. Pay particular attention to staying 2 meters away from others and wearing a face mask if that is not possible. I have reached out to some of the organizing groups with an invitation to talk about how future protests might be able to be structured to reduce the chance of COVID transmission. As we start to see small increases in cases in some of our communities, we need to think creatively about how we hold space for voices that need to be heard, while not risking the low case counts that we have collectively worked so hard to achieve. Later this week, we will share details of our next step in Alberta's relaunch. As we prepare for this step, it is critical that we not lose sight of our collective goal, to allow further opening of society by continuing to work together to prevent spread. We have closely monitored our case numbers through Stage 1 to determine whether we needed to adjust our plans for Stage 2. I am happy to report that our rates of hospitalization and other metrics remain stable, and our daily cases, while fluctuating somewhat, are not currently showing a large spike. As of this morning, I have allowed both the Calgary Flames and Edmonton Oilers to resume practicing in their home arenas with public health measures in place. I look forward to sharing more details about Stage 2 of Alberta's relaunch later this week.
In March, when we were faced with the beginning of an unprecedented global pandemic, our government took a number of critical steps to protect Albertans from COVID-19. One of these measures was to help physicians provide virtual care by introducing new billing codes. Albertans could, with these new codes, access the care that they needed without risking being exposed to COVID-19. And it helped doctors and clinics as safe as possible. Virtual care gave physicians the flexibility to decide on the best way to provide care during the challenging times. And we've seen a great uptake in virtual visits. Recognizing that, today I'm pleased to announce that we are making these codes permanent. Virtual codes will no longer be restricted only to a public health emergency. Physicians will continue to have virtual options to help them provide care, and Albertans will continue to speak to their doctor from the comfort of their own homes. These billing codes allow patient visits, consultations, and mental health services to be provided over the phone or through secure video conference. Now, to be clear, in-person care will continue. This is simply another option for Albertans and their physicians, and physicians will offer virtual services where appropriate. All existing rules and rates for these virtual codes will remain in place. They will also remain excluded from the daily patient visit cap. This will ensure that physicians can continue to provide the care to Albertans, the care that Albertans need, while being fairly compensated. And this is an example of our government being responsive to the changing needs of Albertans. We'll keep on listening and making changes as we continue to respond to the pandemic to support patients and physicians through this pandemic and beyond.